To end the talk, we're going to talk about survival and basically how transplant has affected outcomes in patients with lymphoma and myeloma. And here we have the survival for patients with multiple myeloma, and this is kind of depicted from their years over the last probably 10 to 15 years. In patients with myeloma, it is very important that when we talk to patients, we talk to them about the fact that the transplant in multiple myeloma has changed something that we call progression-free survival, not necessarily overall survival. But it's important to talk to patients, especially depending on the risk stratification about transplant. So there is more still, there is a long way to go because as you can see here, when you look into the myeloma curves, basically it's something that is kind of plateauing, if you will, and it gives you the impression that it is decreasing, but that's not the case because of the fact that, as I said, with a transplant versus non-transplant, sometimes there's a discussion as to whether you can do the transplant early versus late. The recommendation is always to proceed with transplant. There are research certifications. Of course, there could be some caveats, but that is something that, of course, is up for discussion. With the other entities, as you can see, there's also some other significant benefits. In the case of Hodgkin lymphoma, also improved, so the progression-free survival. But again, with the new technologies that we have at this point is up for discussion as to what is going to be at the end, sort of the next strategy. And I think but this is a very exciting time because we have so many different technologies and options at this point that we didn't have perhaps 20 years ago. And this is something unique that is very important for us. So I guess in summary, just kind of to wrap it up, the presentation, autologous transplant still has a significant place in the care of patients with hematologic malignancies, as we review, especially with myeloma and lymphoma. Number two, there's nothing surgical about a bone marrow transplant. This is basically more cellular therapy. And that is why the national organization has changed its name from the American Society of Bone Marrow Transplant now is the American Society of Transplantation and Cellular Therapy, which is the right name to do. There's number three, there's always we'll try to obtain the best response, meaning the best, something that we call complete response before we proceed with transplant. Sometimes it's not feasible, but it still will proceed. There is a significant increasing numbers of autologous transplants, especially for myeloma, some from lymphoma, because of the presence of new technologies and new treatment options at this point. Number four, still, autologous transplant represent a very viable option, and of course, still save the lives of our patients.